Patella.
I'm gonna get closer, guys.
Like this, right? Patella.
Just take a picture of his legs.
New tattoo.
Awesome. What's this right here?
Patella tendon.
Not a ligament, it's a tendon. Patella tendon. What's the bone that it attaches to? Tibial tuberosity. Have you guys heard of Osgood Schlatter's?
Yeah.
That's when the tibial tuberosity has extra calcification and it gets huge. Does anyone have a huge one on their?
A guy in our 38 lecture had it.
He has a
Oh,
big
yeah.
one. So that means that that patellar tendon. Do you have a huge one?
I don't know. Yeah, well, that's kind of personal.
Oh yeah, you got. Only if you say it like that. Do you have a good one, Corey? No? Justin, you have a nice one. Look at that big old knot right there. So what that means is during puberty, he grew faster than everything could catch up. So it adds in that calcification and that patellar. He didn't grow too much, by the way. That could cause the patellar tendonitis because it can't stretch and catch up with everything. That's where that tape job can happen. You would do a lot of strengthening exercises for the patellar tendon. There's a muscle right here. It's really small, but it goes like that. What muscle is that called?
It's gracilis.
Vastus medialis. What? It is, but it's...
That's this. No, wait.
Brevis.
No, not a brevis.
Come on, I'm throwing out stuff.
Starts with an O. Vastus medialis oblique. It's really, really tiny. Like you would think it would be called a brevis, but they call it oblique for some reason. The VMO acts a lot on the patella. So if you have tracking issues, you want to strengthen the VMO. And by doing that, you want to do quad sets. So strengthen your, tighten your quad, but focus on that. You see that right there? Tight right here. Tight right here. That's your, no, hold it. Hold it.
Oh.
That's your VMO right here. Tight right here. See, it's pokey right here. That's that VMO. So you want to strengthen that, relax, and that'll pull the patella back into normal tracking, which then will relieve pressure off the patella tendon.
How do you strengthen that? Doing quad sets?
Quad sets, short arc quads, squats, quarter squats. So what muscle is here? It comes down here.
Gracilis?
No.
Sartorius.
No. It's the quad group.
Oh, that's
Vastus medialis. And this one,
Rectus.
rectus femoris. And this one,
Vastus lateralis.
vastus lateralis. Okay? From the hip, the ASIS is right here, right? That's the little pokey out bones on the top, your anterior superior iliac spine. Comes down and a muscle comes right through here, sartorius, and what else comes down through here? What else comes down there? Starts with a G, you guys have mentioned.
Gracilis.
Yes. Okay, and then, so rectus femoris, vastus medialis, vastus lateral. Okay. On the side here, comes down, it's a muscle up here, then becomes a thin tendon that comes all the way down here and attaches to the fibular head.
IT band.
IT band, what is the name of it?
Tibial.
Okay, so IT band comes right here. What else is on the lateral side? Right about in this area. Just in front of it.
LCL.
LCL. And then here,
MCL.
it's a thick band. You could really see it when you do a figure 4 like this, and you could really feel a thick band right here, like a guitar band. It's your MCL. All right, what bone is this?
Tibia.
Tibia. And this one?
Fibula.
Fib.
What about above the patella? Is the tendon go like a strap across the whole thing, or just in the bottom?
It's actually really huge. I got to see it in person. Like in the pictures you're learning, it looks like this very thin band, right? It's not. It actually, because the rectus femoris comes over and then attaches to patella and becomes the patellar tendon. So it's actually, I would say, about that thick. And then it comes together and attaches to.
Does the tendon go across?
No, there's nothing
Just
that
above.
goes over it.
No, I mean above the patella.
That would be the rectus femoris. All right, flip over. All right, what's this group called? Hamstrings. Go into a flexion. You kind of see, oh, not too much. See this band right here, kind of sticking out? What is this? What muscle is that? Or what tendon? It's a muscle.
Rectus femoris.
Semi-tendons, I don't know.
Semimembranosus.
No, you were right. Semitendinosus.
Oh,
Okay. What about the one right here in the middle?
membranosus.
Semimembranosus. And the band right here, tighten up. Do a hamstring curl. You can see it right here. What's on the lateral side? Comes right here. What hamstring? Biceps femoris. Okay, relax. This space right here looks like a triangle. What is this called? It's a fossa. Okay, popliteal fossa. And it's like an empty space. The borders have specific, this is semitendinosus on this side, biceps femoris, this is the gastroc, and in the middle it's an empty space. So if you have someone that comes up and says, I have pain right here, and you've ruled out a Baker cyst is an extra fluid in the back, then you gotta tell them, you're crazy, there's nothing in there. Right here. There's nothing in there. What muscle? Muscle? Tendon?
Achilles.
Okay, cool. So to test hamstring strength, you have them prone and you have them go into a knee flexion and you try and push them in an extension and that'll show. So to really test it, stabilize here. Don't let me push down. Ready, go? And you're going to check if they have strength with that. With the quad, you'll have them flip over and have their knee at the edge of the table and you'll have them resist against you. Go ahead and turn over. Big artery in your, where is it? It is right in here. Femoral artery is real close into the groin, but know where it is because that's where we go to cut off, tourniquet if your leg's falling off because you fell in Yosemite. Sucks for you. Okay. And we know the ACL's inside, can't palpate that, and the PCL's in the inside. So your joint line, you have to find in a slight flexion. Joint line goes across this way. So this is the tibia, correct?
Mm-hmm.
What is the joint line on the tibia called? It's flat, it's across. If you're a child, yes, but you don't have one of those anymore. You got what bone on top?
Femur.
Femur hitting on the tibia, right? So what is this called?
Femoral tibial.
Tibial surface.
Tibial plateau. Plateau, flat. That's where what lays? Your meniscus lays, okay? And then your femur's on top, and there's two round spots. They're curve on the side here.
Epicondyles.
Those are the femoral condyles. And the patella goes through them back and forth. There's like a groove. That's why the the femoral condyle has a groove here, so it can slide back and forth. So tibial plateau, when he's in a slight flexion, and I'm feeling that joint line, I'm feeling the tibial plateau, and I could actually, if he had, let's say, a meniscus tear in the anterior portion, I could palpate, and if he has pain there, be like, okay, maybe there's something going on, and then do a test for that. The best test is an MRI. It's not worth showing you guys the actual test for it. And then you come up, and you can feel the femoral condyles. Femoral condyles can get contusions a lot, so if you were to jump and then come down on it, you could get contusions in the femoral condyle and the tibial plateau. Okay? Any questions on any of this? No? Okay. Otherwise, that's it for today. So if you guys want to practice anything, have any questions for me, ask away. And no, there is not an ankle tape job on the file. Yay.